So in the second lecture here, we're going to continue with cardiac monitoring. And in this lecture, we're going to talk about the cardiac monitoring leads. Our objectives, we're going to identify and correctly place the limb leads, identify the augmented leads. So the limb leads and the augmented leads are going to essentially go in the same grouping. Describe the components of Einthoven's triangle, which are made up by your limb leads. List the leads that compose the hexaxial system, reference system, which that includes your limb leads and your augmented leads. And list the leads that compose the precordial system, which are the other components of your 12-lead ECG. So the ECG machine offers many views of electrical activity of the heart. The monitor will look at the voltage changes between the electrodes or the leads applied to the body. One thing to remember about monitors is that no matter what the brand, they all have the same basic purpose, and that is to give you the ECG lead out, which is going to be the electrical differences between a positive and a negative. So your modern ECG views electrical activity of the heart from 12 different leads, but in order to get all 12 leads, you have to actually add your extra 6 precordial leads. Your standard limb leads and your augmented limb leads can be viewed by simply putting on your white, your black, your red, and your green on most of your monitors. So your white is your right arm lead, your left is your left arm lead, your red is your left leg lead, and your green is your right leg lead. So your standard limb leads, they are going to be your basic limb leads that are bipolar leads. And so what that means is that there is actually 2 physical poles. The electrodes create 2 physical positive and negative leads on the monitor so you can get a view. This includes leads 1, 2, and 3. So again, leads 1, 2, and 3 are what makes Einthoven's triangle, and we're going to see that in just a minute. All right, so your white lead, your black lead, so your right arm, your left arm, and then your red lead, your left leg. Those are your 3 basic leads there. Now, most machines have that green, which is a 4th, and it takes into accountability for that as well. But for basic monitoring function, you need to know your white, your black, and your red. Your augmented limb leads are going to be what's called unipolar leads. And unipolar leads will take one of these leads and make it a positive, and then the monitor itself will take the difference between the other 2 leads and make it a negative. And then your precordial leads will be, you'll have to use your other 6 leads for your 12 lead, and those are also unipolar leads. So your standard limb leads, they use 2 electrodes of opposite polarity, so you've always got to look at the difference between the positive and the negative. And remember, anytime that conduction is traveling towards the positive, it's going to be an upright waveform. Anytime it's traveling away from the positive, it's going to be a negative waveform. Okay, so let's talk about lead 1. So lead 1 will tell you the difference between the negative lead on the right arm. So the monitor makes the lead negative, and the left arm is going to be positive. Lead 2 is negative on the right arm, and it's positive on the left leg. And then lead 3 is negative on the left arm and positive on the left leg. So this forms what's called Einthoven's triangle. So lead 1, just another view of this, lead 1. Your negative is going to be on your right arm. Your positive is on your left arm. And that gives you lead 1. Lead 2, your negative is on your right arm and your positive is on your left leg. And then lead 3, your negative is on your left arm and your positive is on your left leg. So imaginary lines or axes join positive and negative electrodes of each lead. So the axis of lead 1 would be traveling towards the left arm. The axis of lead 2 would be traveling towards the left leg, and the axis of lead 3 would be traveling towards the left leg. Now, if you can imagine that these lines are actually brought in more towards the center of the chest, you would actually see lead 1 kind of goes across the center of the chest, and lead 2 actually goes down towards the middle at about a 60-degree angle or so. Lead 3 will actually come down at about a 120-degree angle. But one thing you will notice is that if the heart is sitting in the middle of the chest, lead 2 actually gives you your best view. The camera is on the axis of lead 2, and that camera is actually seeing the normal conduction pathway of the heart. Again, this is just another view. So lead 2 would actually be brought in more along this line here, where your SA node, your AV node, and your ventricular conduction's there. So that's why your lead 2 is always going to be your monitoring lead. Your lead 2 can tell you your lethal arrhythmias, and it can give you a basic view of what the rhythm is. Now, what you're going to have to do is get a 12 lead if you see something that's of concern in lead 2. Your augmented limb leads, so the conduction or the electrical output being viewed by the augmented limb leads is very, very small. So that's where the term augmented comes from. The monitor itself actually augments the electrical conduction so that it amplifies it so that you can see it on the monitor. Again, these are unipolar leads, where our standard limb leads are bipolar leads. They don't have a distinct negative pole, so what has to happen is that the monitor has to actually create a negative pole based off of what you're wanting to see. So typically what would happen is that if I've got my left leg, my right arm, and my left arm, the negative for AVR would actually be a combination of my left leg and my left arm. The negative for AVF would actually be a combination of my right arm and my left arm, and then the negative for my AVL would be a combination of my right arm and my left leg, and then we will get that view. So using the concepts that we've already talked about, if a conduction is traveling towards a positive, in reality, anytime the conduction is going down the normal pathway, that means that it's traveling towards the positive for AVF, and it's going leftward, so it's traveling towards the positive for AVL, but it's going completely negative or away from AVR, so you should see a negative deflection in a normal ECG for AVR. And this is what I was just saying just a moment ago, except in this time they actually take into account the green lead to make the negative for AVL. Now, if you take your Einthoven's triangle, which is your lead 1, your lead 2, and your lead 3, and combine it with your AVF, AVL, and AVR, they form what's called the hexaxial reference system. Now we will look at this in a lot more depth whenever we get to the 12 lead lecture. So your precordial leads, your 6 precordial leads or chest leads or unipolar leads, they record electrical activity of the heart in a horizontal plane. So let me mention that really quickly. Using the leads that make the hexaxial reference system, these leads actually record on a vertical plane or a top to bottom. So top to bottom or up and down. Whereas your precordial leads, they record activity from the inside of the heart out. So they're actually looking at the conduction as it's traveling through the myocardial tissue and not just the electrical conduction system. And that can be seen on this next slide here. So if you can imagine V1 through V6, which are the leads that you place on the chest for a 12 lead, these are going to be numbered V1 through V6, and these are going to actually look at the electrical conduction as it travels through the septal wall of the ventricle, of the anterior wall of the ventricle, the inferior wall of the ventricle, and the left lateral wall of the ventricle. And again, this will be more prominent when we get into 12 lead. All right, so this again just is another view. So the negative itself actually is going to be at the cross point of Einthoven's triangle or the hexaxial reference system, and they form what's called Wilson's terminal. So all 6 of these leads are going to have the same negative, which is from the dead center of the heart, and that's called Wilson's central terminal. It's critical that these leads are placed consistently. V1 should be placed on the 4th intercostal space to the right of the sternum. V2, the 4th intercostal space to the left of the sternum. V3, directly between leads V2 and V4. V4, the 5th intercostal space at the left midclavicular line. V5 at the level of lead V4 on the left anterior axillary line. And then V6 at the level of lead V4 at the left mid-axillary line. So this covers the basic lead groupings of cardiac monitoring. As we move on, we'll get more in depth with cardiac monitoring itself. Again, reach out if there's any questions.